Please go ahead. Please go ahead. Please introduce yourself to begin with, Harshada.
Myself, Dr. Harshada Dhokar. I am from Mumbai, and currently I am practicing in a private clinic. It is not my own clinic. I'm on salary basis there, and I have a total experience of 4 years after my bachelor's. And next, the first thing I would always like to say to both of you that I'm fortunate to have this course required.
Your voice is breaking, Harshada. Okay, I think there seems to be some internet connectivity. What you can do is stop your video and speak. Probably that will give. Yeah, now you can.
Okay.
Let's try.
Okay, sir.
Yeah, it's very clear. Go ahead.
Is it clear now, ma'am? Yeah, so I'll repeat the sentence I told, that I feel like very fortunate to have found this course, because I was at this stage where I was thinking about what exactly is my future in India as a physiotherapist, after having some few ups and downs about my career and about my plans, because I had one failure after having a clinical setup where in 2020 January itself I launched a clinic. In March 18 there was a lockdown, and after that I lost like the confidence, and that failures were something which made my confidence shake. And after that, I was planning this year to have my own clinic set up again, to give it a try. And before that, I always wanted to know that there is something which I need to learn first before putting that launching that clinic. I need some skills, and there is where I found about this course on Facebook. I came across this, and it's like I can say the signs of God only that brought me to this course. Actually, about this course, I would say there are many courses which will teach us about technical skills and applications, but there is no course that will teach you about communication with the patient, conversation, other C's which you told about C5. Those skills no other course is going to tell us. So hence this is what makes your workshop a class apart, and I can say this is the best decision I have made, and I just don't regret that I just took this decision. Next, I would say about the challenges that I faced before. Mainly it was about my communication with the patients, like how ma'am in MDCs has counseled the patients. That way I try to apply. I used to like 2 or 3 times during the course of period, I used to listen to them and then apply to the patients. And that with every MDC I started to gain confidence, and I could see the reaction from the patients too. Like their trust had started to build up. Before I like in as a person I'm quite inexpressive, or you can say not that extrovert. I'm a reserved kind of. But then after having this course, I personally also grew. I started being more expressive, and I started also counseling people at home also, and also started counseling the patients also. And that's how mainly as a person it has taught me a lot, as technical also, but more I can say which I always needed was communication thing, was something I always wanted to learn. And this platform has given me that, which is very precious. And um, about the journey in last 4 months is, hello?
Yeah, please. We are listening.
Video was not available. Yeah. So the journey, I can say, like my schedule was quite busy, but I always had an excitement that today I'm going to learn something new, or today there is something ma'am is going to tell which is I never knew before. And Dr. Priyanka ma'am, I would say you're really a boon to the Indian physiotherapists. And really you both have made such great efforts, tremendous efforts. Like I always फेल्ड, सबको ऐसा होता है ना कि अपना खुद का दुख बड़ा लगता है, बट आफ्टर आई हैव सीन जर्नी ऑफ यू बोथ, एंड आपने जो एफर्ट्स लगाए हैं टू रीच दिस लेवल इज ट्रेमेंडस. मतलब रियली हैट्स ऑफ. आई डोंट हैव वर्ड्स राइट नाउ. बहुत ही हार्डवर्क और डेडिकेशन था. एंड like yeah, so the transformation is both as a professional level and personal level, दोनों तरफ से transformation हुआ है मेरा. And the reaction from patients, उनका trust, they have started saying that we are like, they always tell me that now we trust you, so we are asking you this, we trust you. Your trust factor जो sir ने हमेशा बोला था कि gain the trust first, then everything is possible. So that's what I've always tried to focus on.
Great.
Yeah.
So you are able to apply the learnings in the clinic where you're working today?
Yes, sir. See, sir, about the treatment part, I'm able to apply. Just about the pricing, I'm not able to apply. The advance payment thing, I'm not able to apply.
Okay, they have
That's
their
what.
own pricing
Rest,
systems.
yeah, treatment PBPS skills I am applying since I have like learned the joint techniques one by one. So I have seen the results too with PBPA. In like even in 21 days, patients have recovered very faster in even 20 days also with the exercises. And exercises are really helpful and really good, like targeting on each and every muscle of your body, of the joint. And yeah, like I have seen the results.
So why treatment? What about assessment? What about diagnosis? Don't you consult a patient?
Yeah, sir, I do consult, but because of the time constraints, I have to cut them short sometimes. That is what. Because that is not in my own clinic. That's what.
So you mean to say they consult and they'll send you for a treatment?
No. I only consult, but because of the slots of the timings, I have to.
I mean, what is sorts of a treatment?
Yeah.
What I mean, I did not understand your consult.
No, the timings are, sir, like 10 to 1.
Yeah.
And rest of the times I am on visit basis. So
हाँ,
so
तो ठीक
during
है.
that,
So 10 to 1 you go for a clinical,
yes, sir.
right? So वहाँ पे आप assessment और diagnosis और consultation करते हो कि नहीं करते हो?
Yes, sir, करते हैं.
You do that, right?
Yes.
Okay, and post which the treatment starts.
Treatment starts. So just I was saying, due to time constraints, थोड़ा पूरा assessment नहीं होता है, या फिर because of pain, again I don't make patient every movement जो tightness वगैरह check करना है, don't make them do all the movements on day 1 itself.
So no problem. See, on day 1, if it is not possible, considering the genuine physical problem, like let's say pain, discomfort, or if patient is already annoying with the pain and all that things. So obviously, see, focus on the assessment is one thing, and patient comfort is one thing. But that doesn't mean you are skipping is not good. You can for 1 or 2 days make them comfort, or let's say till the time you have start the exercises, within that 3-4 days. You can finish all the process of assessment, because that will improve your learning.
See, not just learning, I would say, because through assessment you are going to come to a precise diagnosis.
Yeah.
Yes, sir.
Right. So probably he may,
problems.
they may come up with certain kind of, let's say, back pain, but along with the back pain, what all the other problems are involved, right? Or which joint I should be able to suggest. Okay, so जहाँ पे वही तो काम है, अगर restrictions है, अगर tightness है, तो वही तो आप check कर रहे हो ना कि this is how नहीं, तब पता चलेगा आपको कि exactly कितने दिन का prescription भी करना है आपको.
Yes.
Right. So I don't know.
That's what, first of all, this is nothing but never ever compromise on the treatment, because see, this is the difference over here. See, your focus is right now being as an employee, you are only working at treatment part. Okay.
Yeah.
Because you are not that's what you already mentioned, that you are not dealing with the price and getting the amount and all that things. And that is the reason you are not focusing on assessment also, because it is directly related to all these things. The same time it is related to your treatment and results also. You will going to get the results within 21 days, but the same time, this is nothing but why the patient needs to go for this much number of days, and why he has or she has to pay that much amount. That is the part of your assessment. It is related to consultation. It is related to your payment. It is related to patient continuity. It is related to treatment. It is related to patient discharge and patient feedback. So everything is interconnected. So don't think that right now I don't have my clinic. Yes, I can understand only you get the limitation where you cannot apply the same price structure. But you are handling the complete clinic here. You are alone. How is it?
No, evening there is another, and morning I am there.
No problem. But
even during your presence also, you are a whole and soul over there, or you are a part of it. There is someone also like your
employer,
no other physiotherapist.
So everything, if you are doing, so utilize the proper learning plus implementation, everything on patient in terms of proper assessment, in terms of getting the proper amount, in terms of getting the proper treatment done by the patient themselves. At the same time, complete recovery is only possible.
Because I was worried about only the assessment and basically that part. She's talking about treatment is okay, but assessment she is not doing. Okay, so
don't skip that part.
Whole, like no, I'm saying that no, like I do that, but not the whole, like this each and every.
nahi karna hai. See, over a period you will gain that speed. Don't worry on that speed.
See, that's what theoretically and learning point of view will think that there are 60 parameters. I need to do it. But believe me, on practical, when you have a patient, okay, so every patient is not like, see, all chronic patients, acute pain, it is very severe pain where patient cannot do any movement. But when it comes to any chronic condition, aram se you can do every assessment. On day one, if it is not possible, remaining you can get it done on day two. But that will assure the right diagnosis, that will assure then treatment plan. Otherwise, what will happen? When the journey of treatment will start, it may happen, or it definitely going to happen, that patient will start saying that, acha pehle back pain tha, ab shoulder pain bhi hai. Or because of that hidden cause, if you cannot able to find out, when you go for the basic level of exercises like cat and camel. So in cat and camel, all your joints get involved. And if suppose if you not did the assessment thoroughly, and in that, if you cannot able to find out the patient is already having shoulder pain, on that day, if patient is smart enough, they want to take the wrong benefit. What they will do? कि मैम मैंने तो ट्रीटमेंट शुरू कर दिया है, अभी मेरे बैक पे तो मतलब ठीक लग रहा है, बट शोल्डर पेन शुरू हो गया, ऐसे कैसे हो गया? That time you will going to lose the confidence. Why? Because you have not done the previous assessment, and it is very common with any cases. And that's what patient don't never ever think that उसको एक ही condition है, वो हमेशा सर्वगुण संपन्न ही होते हैं. Rarely you will get a pure case. Pure means back है तो back ही रहेगा उसका. Otherwise ये वो joint involve होना ही है. And that's what assessment को कभी भी skip मत करो. This is basically the assessment and diagnosis makes you first of all doctor, being a physiotherapist. And based on that, treatment comes. So I hope now you'll focus on this point.
Yes, ma'am, I'll completely.
The first and the foremost thing is कि उस क्लिनिक को आपको आपके क्लिनिक से ही ये करना है. You should think that it's your clinic only. And okay, you need to be loyal, you need to be trustworthy, you need to be so attached to that particular clinic. Okay, when you leave that particular clinic probably and after a year or two or whatever as such, okay, both should have that feel ki, I'm losing a good employee, and you should also feel that yes, I'm getting detached with a place or a clinic, okay, which is so close to my heart, right? So you should have that kind of an attachment, okay, with the clinic, with your patients, and with that these things, okay. So uska environment अच्छा बनाने का काम आपका है.
Yes,
okay,
definitely.
Never ever think that I'm an employee here. Okay, always work with an employer mindset. Okay, irrespective of whether you are an employee over there, doesn't matter. But you, in one particular, after probably on down the line, okay, you are going to own a clinic. Okay, so you should be able to develop that employer mindset and take that responsibility and ownership, right?
Yes.
Okay, अगर आपको कुछ वहाँ पे like assessment का अगर हो गया या किसी का कुछ limitations आ रहा है, तो speak to your owner, okay, speak to your employer that can I also do this? Take initiatives. Don't think they won't give. Have you ever asked? Right? So unless you take that initiative, they will also have certain kind of inhibition that यार इनका तो ये काम नहीं है, अगर मैं अगर बोलूंगा तो फिर से छोड़ के तो नहीं जाएंगे, या ज्यादा सैलरी तो एक्सपेक्ट नहीं करेंगे, या ज्यादा ये तो नहीं करेंगे, वो तो नहीं करेंगे, right? So make sure that don't relate every role, every additional activity with a salary, with an amount. Okay, so you're going to learn, okay, which is absolutely giving you an confidence, right? And
Right.
when you open your clinic as such, okay, that really matters, right? So whatever the things that you have learned, okay, make sure, try to see what best can be implemented. Okay, do discuss with your employer. Okay, कभी ऐसा मत समझना कि अगर मैं बोलूंगी तो मेरे पे ही आएगा, उल्टा अच्छा है आने दो. Okay, invite the work. Okay, take those initiatives and agar, that's what, if you are getting some 15,000-20,000 rupees there, okay, make sure that you give back 2 lakh rupees, right? So that this is how basically both of you as well as your employer are able to grow, and that's how we can bring in more of an better ecosystem for the physiotherapists as such.
In
Okay,
fact, this is
so
an opportunity.
exactly.
So that it becomes much easier for you. The moment you open your clinic, you will going to implement replica. Never ever consider that when I will open my clinic, I will do these things.
ऐसा कभी नहीं
और
होता है.
ऐसा कभी नहीं होता है.
Okay.
So
Right.
make it habit.
Okay,
Yeah.
and you got that opportunity, okay, to work
Yeah.
without your investment as such. Okay, so make sure that you utilize it fully, right?
Yes, sir, definitely, sir.
Yeah. So when do you want to open your clinic now?
So probably this December or by January, I'm looking for.
Okay,
opening.
in a month and two as such,
Uh-huh.
right? Okay, so make sure you follow the resignation process properly. Okay, whatever the notice period is there, make sure
Yes.
you give a proper notice period, and most important, maintain an good relationship with your employer, previous employer. Okay,
Yes.
so never ever just break those relationship and चलो अभी हो गया मेरा काम, ऐसा मत करना, ठीक है ना? They should miss
Yes.
you. Okay,
Yes.
ultimately the patient and the employer should miss you, not for a day or a month, till the time they are running a clinic as such, right?
Right.
So you should set an example over there कि यार हर्षदा थी, okay, who was more who was so good that I was so dependable. They should feel that dependability, their dependability on you,
Right.
right? ऐसे काम करके दिखाना है, ठीक है ना? Okay, so yes, so what is the one advice that you want to give to an fellow physiotherapists who are thinking about doing this
Yes,
workshop
sir.
as such?
As ma'am has always mentioned कि, and you also about that कि बाकी workshop में जो advanced करके जो specify किया जाता है, and we all just run behind that. That shouldn't happen. We should actually know what is the core physiotherapy, and जो आपने जो workshop L2 है, that is the core of physiotherapy, and that is what is required right now इस stage पे जहाँ इंडिया में it is very difficult for a physiotherapist to survive. So I can say कि like definitely each and every physiotherapist should go for this course so that हर एक का opinion same होगा, so that patient cannot show a distress कि उसने अलग बोला इसने अलग बोला. So that is what is more important. As you said, uniformity is more important.
Good, Harshada. How many years of experience you have now?
4 years, sir.
4 years. After BPT or MPT?
PPT.
BPT. Okay. So is there any change in the behavior of your employer towards you after doing this course or in this 4 months as such? Did they observe
Yes,
your
sir.
change in the transformation, any transformation as such? Any comments that they pass on?
Yes, sir. My interaction with the employer has also increased, and communication with the patients have also increased. Before, after consultation, I used to directly start with the treatment machine and exercises. Now I sit and give them time to explain that how it will be, and how exercises are more important than the machines, and how passive treatment will work temporarily, and exercise will help you this to make it a sustainable journey for you, and to avoid surgery in further. All these things I have seen, and with the seniors and all, yes, they have definitely seen that improvement. Especially in my communication is the main thing which I got from this workshop is about my communication, I can say, with the patients.
But did you know about such kind of a treatments available? Were you following the this kind of an treatment protocol earlier?
Which, sir?
I mean 30 days का हर एक basic progressive advanced pain management इस तरह से follow करते थे आप पहले?
No, sir. It was like basic to progressive. Now, one example I'll give you, sir. I worked in QI spine before. There was this followed कि basic, progressive, advanced exercise. वहाँ पे कुछ 24 sessions का है. So that I had a little idea कि ऐसा किया जाता है. But then, मतलब the way you have put it out कि वहाँ पे जैसे pricing and all is also too high. So not everyone goes for all 24 sessions there. There also they try to convince the patients more, and उस वहाँ पे भी strengthening and all पे focus किया जाता है, but because of the high price and only one technique of like they use McKenzie technique and all that. So I've seen that their basic, progressive and advanced वहाँ follow किया जाता है, ये मैंने देखा है.
Okay, so don't you think जब तक आपका ट्रीटमेंट कोर ट्रीटमेंट स्ट्रांग नहीं हो पाता आप उस कॉन्फिडेंस से नहीं बोल पाओगे? डू यू थिंक सो? या सिर्फ व्हाट आई एम ट्राइंग टू आस्क हियर इज unless you have a strong treatment backup, unless you have a strong backup plan ki this is how I am going to plan the treatment right now, okay, for this condition, right? जब तक आपका बैकअप स्ट्रांग नहीं होगा आपका फ्रंट एंड का स्ट्रांग कम्युनिकेशन हो सकता है क्या?
नहीं सर,
नहीं हो सकता ना.
yeah.
Right, so don't you think that's a learning as well from this workshop as such for you?
Yes, definitely.
Right, क्योंकि बात तो बहुत कर लेंगे, कम्युनिकेशन से बात तो बहुत कर लेंगे, right? But you are not the person what you speak, you are the person what you do, right? So what you should do, if you are not aware of it, you can't even speak, right? And if you speak and you won't be able to do it, then whatever the things that you have done in speaking, that backfires. Right. So never ever underestimate the other parameters that you have learned, right? And every single parameter is connected, it is not isolated. The problem today, you guys have been learning from the other probably workshops or probably the other these things and everything is all isolated, and since they are all isolated you are not able to connect the dots. But here in this workshop as such, okay, everything that you have learned is connected, right? Communication सीखा क्योंकि आपको बात करनी है पेशेंट्स को, right? तो वहां से अभी वो आपके क्लिनिक में आएगा, जब आएगा तो वहां से आपको असेसमेंट शुरू करना है उसको. जब असेसमेंट करोगे तो डायग्नोसिस कैसे करना है वो सीखा है, तो डायग्नोसिस के बाद ट्रीटमेंट डे वाइज कैसे करना है वो सीखा है. उससे पहले हर एक पेशेंट्स का जो है ना इस पर्टिकुलर कंडीशन के लिए ड्यूरेशन कितना प्रिस्क्राइब करना है और प्राइसिंग क्या होना चाहिए, सिंगल जॉइंट, टू जॉइंट, व्हाटएवर दैट दिस थिंग्स एज सच, राइट? एमएस के, न्यूरो केस, ये केस, वो केस, जो भी रहेगा, ओके, वो सीखा है. उसके बाद ऑन अ रेगुलर बेसिस पे जो है किस तरह से कम्युनिकेशन होना चाहिए, राइट? और ऑन अ रेगुलर बेसिस क्या प्रोडक्ट रिकमेंडेशंस करना चाहिए, राइट? क्या एक्सेसरीज रिकमेंडेशंस करना चाहिए फॉर अ स्पीडियर दिस थिंग, ओके, रिकवरी, ओके. और जब डिस्चार्ज के टाइम पे किस तरह से एक्सरसाइज का रिकमेंडेशन होना चाहिए सो दैट दोस सस्टेनेबल होगा रिजल्ट्स, राइट? और यहाँ पे द ऑपरेशनल थिंग्स, राइट? Then the HR things, then the marketing things, okay. There are so many things, and I'm surprised that you are saying only the communication part you have learned in syllable to exercise.
No sir, there are obviously many things, but what I wanted to mention that I always lacked in communication, and this was the biggest platform where that I have learned, because everywhere else we have learned everything, but not this main thing about what you have covered about the end to end. Because technical skills everywhere is covered by any other forms, any other workshop.
But in this format?
Yes, sir, obviously it was like what the word suggests about E to E, like from the A to Z everything is covered, and that is what is making this workshop very different from the others. And obviously now I've learned about this, what you've told about that supports that you're using, and as ma'am has mentioned about the pain management lecture, where when to use ice pack and when to suggest hot and when to give contrast. All these things are small things I've been like applying since I've learned them. In this 4 months I am like already applying those.
And one more thing, there is nothing called as a small and a big. There is nothing called as, the basic progress, basic and advanced as a thing is, whatever is required to be done, that is required to be done. If you don't do that, okay, then whatever that you think is small is going to make bigger problem. Okay, so every single thing that you need, you do is needed, and that's the reason it has to be done, right? अगर मैं सिंपल लैंग्वेज में अगर आपको समझाऊंगा, अभी समझो किसी को अगर हाथ पेन है, सॉरी लेफ्ट हैंड में पेन है, ठीक है, तो थोड़ा सा अगर टुवर्ड्स चेस्ट भी अगर आ गया, तो अगर वो कार्डियो के पास जाएगा तो वहां पे सब कुछ वो सब टेस्ट करेंगे, ये सब कुछ करेंगे वगैरह, और वहां पे आइडेंटिफाई होगा कि नहीं, इसको कुछ प्रॉब्लम नहीं है, हार्ट प्रॉब्लम नहीं है. And when they come to you, okay, you will realize that this is an muscle problem, tightness का problem है, जो भी problem है, and you will do that. So do you think your treatment is smaller than that cardiac treatment and something of that sort?
No, not at all.
Not, right? Because that is not needed at this stage.
Yes.
So whatever you are doing is as per the requirement. So never ever imagine that कि कार्डियो ने इतना कुछ टेस्ट करके 50,000 का 1 लाख रुपए का उसको बिल दिया, ओके, तो वो बड़ा हो गया और आपने 10,000 में उसको ट्रीटमेंट दिया और वो ठीक हो गया, तो आप कम हो गए. अगर ये मेंटालिटी का आप पेशेंट को भी डेवलप करोगे और अपने आप को भी खुद डेवलप करोगे, तो you will never be able to give that importance to your own field as such. Please understand what I'm trying to say here, right? So it is, जब तक आपका फाउंडेशन स्ट्रांग नहीं होगा, जब तक आपका बेसिक स्ट्रांग नहीं होगा, you will never be able to gain that mastery. And whatever the things that you learn are not going to be strong because the basic, your foundation is not clear. जब तक फाउंडेशन क्लियर नहीं होगा, जब तक फाउंडेशन स्ट्रांग नहीं होगा, कोई भी बिल्डिंग भी नहीं बैठता उसके ऊपर. You guys need to understand that, right? Never ever think कि मैंने कुछ टेक्निक किया और वो 10 मिनट के लिए रिजल्ट्स दिया या 1 दिन के लिए रिजल्ट्स दिया या 5 दिन के रिजल्ट्स दिया, तो वो बड़ा हो गया, मैं छोटा हो गया because I do some 30 days of treatment. No, the reason is ultimately the motive. What is the motive? Motive is patient result sustainability. वो जितना लॉन्ग रिकवरी उसको मिलेगा, उतना ट्रीटमेंट आपका स्ट्रांग है और वो ट्रीटमेंट उतना अच्छा है. It is not about your short term, it is about the patient long term results. Please understand that. आप कितने फास्ट रिजल्ट्स ला सकते हो doesn't matter. वो रिजल्ट्स लाया हुआ कितना देर तक टिक सकता है, that matters to the patient. ओके, जब हम लोग पेशेंट इंटरेस्ट के उसमें काम करने के लिए बोलते हैं, तो वो सेकेंड वन जो मैं बोल रहा हूँ वो मैटर करता है. इट डजंट मैटर, पेशेंट एक्सपेक्ट करने दो ना, कोई प्रॉब्लम नहीं है. मतलब मुझे फास्टर रिजल्ट्स होना चाहिए, मुझे इसमें होना चाहिए, दैट इज हिज एक्सपेक्टेशन. एंड एवरी सिंगल person including you, when you are suffering, you are expecting the same thing. So you must be able to ask the right question. Do you need a faster results, no sustainability, or it may take certain time but a longer recovery period, sustainability? You ask this question and see what patient says to you. नहीं मैम, टाइम लगने दो, मुझे रिजल्ट्स अच्छा चाहिए. So you should be able to get that from the patients. You should be able to ask the right questions, you should be able to give that right delivery, so that you'll be able to have gain the trust of the patients as such, right? That is the most important. Never ever hesitate to ask questions.
Right.
Now
right?
when you will before opening your clinic, you will start looking all
Yeah.
the things.
Correct.
all management lessons you need to
Huh,
go
I mean,
through it,
see,
because you have not touched yet that
Yeah,
part through your practice, since you working as
Yes.
an employee. So full-fledged benefit you
जब
have
आप
not
खोलोगे तो you know
yeah,
management को
taken.
सारा you know you'll understand its importance, but please understand unless you have a strong treatment backup and everything as such, you can't communicate. Okay,
Yes.
वो क्या होगा पता है क्या? बोल बच्चन बोलते हैं उसको. बोल बच्चन बनना चाहते हो?
No, sir.
Okay, तो strong बना है, अगर legend बनना है तो excellence हासिल करना पड़ेगा. Right? So make sure you do that. Right?
Yes.
So thank you, Arshada. Thank you for sharing your experience as such. Okay, and we wish you all the best, and open your clinic fast so that you know many more patients will be able to you know take that benefit as such for the entire end-to-end
Yes.
skills as such that you
So
have
that you
learned.
can
Yeah.
able to implement all